Hi folks, Dr. Ed Beyer. Today I'm going to start on a little venture here where we're going to be going over 22 different ways that your thyroid, a person's thyroid, could become low. Traditional medicine only looks at one of them. So many of my patients that come to see me have a low thyroid and they've been getting their TSH checked and they're on different medications, Synthroid, levothyroxine, Armour, Unithroid. There's a bunch of different ones out there. And the doctor's not looking at all the multiple ways that your thyroid can go low. So today we're going to be talking about 4 of them, and they all start in the brain. Now, TSH is a hormone that I'm sure many people out there are familiar with. It's a brain hormone. It's not a thyroid hormone. It comes from an area of the brain called the pituitary gland. Now, the hypothalamus and the pituitary gland work in tandem to control many of our hormones, and thyroid is definitely one of them. And so the hypothalamus directs hormone function via the pituitary gland, and TSH is what comes out of the pituitary gland to stimulate our thyroid gland to make T4 mostly and a little bit of T3. Now, this area of the brain, the hypothalamus, will not work properly if we do not have adequate levels of serotonin, which is a very important brain neurotransmitter. Now, many of the patients that come to see me have serotonin deficiencies, and there's many reasons why they have it. So we have to look at this because this is a very common low thyroid pattern that I see in my clinic that doesn't get looked at out there in traditional medicine. Low blood sugar can cause serotonin deficiencies, and there's many reasons why someone out there could have low blood sugar. A poor weak adrenal glands, poor liver function, poor diet, insufficient B vitamins, gut infections, gut problems, hyperglycemia or insulin resistance for diabetes. Wow, a lot of people have that. So when we have fluctuating blood sugar, that affects the ability of serotonin to get into the brain where it's needed, and that will affect thyroid function by way of the hypothalamus not working right. Poor gut absorption and function because we need certain amino acids like tryptophan, B6, B9, B12, magnesium, iron to make serotonin. We need those things to be absorbed. Genetic mutations, I'm not going to get into that too much, but this one right here is very common, MTHFR, where we're not activating folic acid into methylfolate, which we need to make serotonin. And too much serotonin, folks. Like many people are on selective serotonin reuptake inhibitors, which are a common medication given for depression, and that's going to flood your brain with too much serotonin, and then the cells become serotonin resistant, and they stop listening to it. Well, these are the causes of serotonin deficiency. It's a major cause of underactive thyroid. Now, the symptoms of serotonin deficiency, besides low thyroid, are many. Depression, insomnia, fibromyalgia, carbohydrate cravings, anxiety, irritable bowel, panic attacks, mood swings, lack of willpower, PMS, hormone dysfunction, obesity, and migraines. So these are some of the other symptoms we commonly see with those who come in with hormone deficiencies. Now, many people that watch my videos are interested in, where do you come up with this stuff, Dr. Beyer? And I'm telling you, everything that I share on these videos is in the scientific literature. So I'm going to end our discussion on these different 22 ways on just giving you some scientific literature.